Hello, Shelley. My name is David Thrasher. I'm a pulmonary critical care doctor in Montgomery, Alabama, and I've been battling this COVID pandemic since actually before it was in Alabama, February of 2020. And it's my privilege to help the Poarch Creek Indian tribe. Y'all have been great doing everything that people have asked you to do, and it's my privilege to help you. I'm going to tell you right now, I have studied all the data. I've been asked to participate in Operation Warp Speed. I've seen all the clinical data. I've talked to the CEO of Pfizer and other people with the CDC. This, I think, will be approved very, very soon by the FDA. At least I hope so. This is going to go down as one of the safest vaccines we have ever produced. Now, treatments have changed. At first, we didn't know how it was transmitted. We were worried about the touch. We just didn't know. We didn't know. Now we know that it's almost always transmitted by aerosols or in the air. Okay, I can give it to you by just simply talking to you, coughing on you, or being in a church choir and singing. So that's how we get it. Now, what do we do with treatments now? We have tried a lot of things, okay? My group has tried about everything, and we've researched every drug that's been tried. We used hydroxychloroquine last year when President Trump was touting that. We don't use it anymore. The studies have unequivocally showed that that doesn't help. We've used ivermectin, we call it the worm pill. We've used that extensively, but there's no data that shows that it is truly effective. And several colleges of infectious disease recommended not using it. The NIH say they're not sure, but we have not found that to be beneficial. I first started recommending a bunch of vitamins, zinc, Zyrtec, Z-Pack. Okay, we know that none of that really helps. What helps now, if you have it, are basically three things. Okay, one is inhaled steroid called budesonide. Many of you who have had COVID know what I'm talking about. You put it in a breathing machine, a nebulizer, use it twice a day. We also recommend an adult aspirin, not a baby aspirin, but a 325 milligram aspirin, assuming you don't have contraindications to taking aspirin. The third thing is steroids. Okay, now this is very important. Do not take Medrol dose pack, prednisone, or let somebody give you a steroid shot in the urgent care in the first 6 days of symptoms. It will hurt you. In the first week of the when you get the virus is circulating through your body, and the body makes what's called interferon. That's part of our immune system. That's good. The interferon attaches to the virus and prevents it from getting to the cells. That's good. If you use steroids in the first 6 days, it blocks the interferon. Now you feel good and you say, oh boy, this is great. It's not going to be bad. Then day 7 to 17, you can fall off a cliff and can die. So do not use steroids of any type in the first 6 days. After day 7, we frequently do use those, and they're very helpful. But the big thing we have right now is called the monoclonal antibodies, okay? This was the thing that President Trump used last year. You remember when he got sick, he was given some treatments. Now, the public doesn't know what he got, but I do. He was given Regeneron. That's the monoclonal antibody we have now, and what we're giving to you that get the virus right now. He was also given remdesivir. That is an antiviral that's only given in the hospital, and University of Alabama, Birmingham in medicine, UAB, was largely responsible for developing that treatment. And the third thing he got was steroids. He didn't take hydroxychloroquine. He didn't take ivermectin or other stuff. So that's the treatment he got. Now, this is very important. If you get sick, okay, or you're exposed, first of all, let's say if you're exposed to someone and you have symptoms, immediately go get tested. If you're exposed to someone with a virus and do not have symptoms, wear a mask, quarantine, and on day 4, get tested. If you do have it, immediately call the doctors there, the April cells, the chair, the council, whoever, and they will get you in touch with somebody who can talk to you about the monoclonal antibody infusion. That's called the Regeneron. That's what President Trump got, okay? It works. It works extremely well if I get you early. It has to be given within 10 days of symptoms. Ideally, if I can get it to you in the first 5 days, I've got a 90% chance of keeping you out of the emergency room, keeping you out of the hospital, and more importantly, not dying. I can't emphasize how important that is. We got that set up. And matter of fact, you need to realize that 2 of your tribal members were the first 2 patients to get the monoclonal antibody in the South, and only the 17th and 18th person to get it outside of clinical trials. So the Poarch Creek Indians are on the cutting edge of monoclonal antibodies. You're going to hear a lot more about that in the coming weeks, as there's going to be a big push by the governor and the others to educate the public and providers about the monoclonal antibodies. So what you need to know, if you get sick, get tested. If you get exposed, wait 3 to 4 days, get tested. If you're positive, call the clinic or April or the chair, whoever, and get you in touch with somebody and ask, do I qualify for the monoclonal? If they say no, tell them you want a second opinion. I say, if you walk and talk and live in Alabama, you qualify. They have broadened the qualifications so much that almost everybody in Alabama qualifies.
So first is, how was it created so quickly?
Great question. You say, well, it was created so quickly. It was created 11 months. How could that possibly be safe? Well, it was not created in 11 months. After SARS in 2003, I believe it was, they started working on a vaccine for SARS. They've been working on this what's called messenger RNA vaccines for almost 20 years. So it's been a long process, and the fundamental technology was there. When the Chinese government shared the DNA, I think it was the middle of January, within 2 days, we knew the quote formula, okay? We'd already been working on this for 20 years, so it was not fast at all. We had the technology, we had the skeleton, if you will, for the vaccine. And then we plugged in the DNA of the virus, and the real 11 months was just proving it was safe. That's when all the clinical trials were. So it's not a fast vaccine. Most vaccines take 8 years to produce, but we have had a head start on this one of 20 years.
The next question, what are the risks for healthy people?
What are the risks for healthy people of getting the vaccine?
Yes, sir.
Basically none. Okay. It was approved and highly recommended just last week for pregnant women. It's recommended for children 12 and over. I predict fairly soon it's going to be recommended for 12 and under 12. It is very safe. You can have a sore arm. Now, my third son, he was in bed for the second shot. Okay, it kind of knocked him out. You know, next day he's normal. That's when you have a robust immune response, that's actually good. Okay, but it's the other risks. Very minimal. There's side effects to every medicine. There's side effects to every vaccine. The side effects of this is very minimal. You've heard about the Bell's palsy, which is a temporary paralysis of your facial muscles. These are all extremely rare.
What are the risks for people with chronic health issues?
They're the ones that really need it. Okay. Well, let me back up. I would have said that strongly last year. Now the young people really need it. Most of the older folks have been vaccinated. Now this Delta virus is hitting the young folks horrible. We've got the average age is probably in the mid 40s, maybe early 50s in the hospital and on ventilators. 95% of the people that we're seeing in the hospital are unvaccinated. The ones that are vaccinated that end up in the hospitals are the ones that need the boosters. These are the immunosuppressed, those who have chronic kidney problems, rheumatoid arthritis, diabetes, other issues like that. So it's a very safe vaccine. If you have chronic illnesses, you're the ones who really need it. All right, there's a question about fertility. That's a great question. I understand it totally. Half of my young women in my office won't get the vaccine, worried about fertility. I want to refer y'all to Facebook. Now, I've never done Facebook before this pandemic. I've started using it as I posted a lot of articles. You've probably seen some of those. My daughter-in-law posts them on there. If you go to Facebook and type in Medical Association State of Alabama, it comes up and push video. If you hit video, a couple of weeks ago, about 3 weeks ago, I did a update on the Delta virus with Dr. Sag at UAB. The following week, we had the head of infectious disease at Children's Hospital talk about kids, vaccines in kids, and risk. 2 weeks ago, we had the head of South Alabama Medical School, OB, talking about the fertility myths, the risk to the pregnant women, et cetera. So there's a good base there if you go on Facebook under the massa and push those videos. Answer your question about fertility. We do not think there's any risk of fertility, male or female. It just hadn't shown out. The vaccine is out of your system in 48 hours, okay? It doesn't linger. It doesn't get in your placenta. It doesn't change your DNA. Now, some people, I wish it did change their DNA, but it doesn't. It is safe. It does not cause fertility problems. The American Association of OBGYN came out strongly this week, recommending all pregnant women get the vaccine. Just in the last week, our group alone has had 3 women where we had to get the OB doctors to do an emergency C-section to take the babies because the mothers were in risk of dying of COVID. If you're pregnant and you get COVID, it is not pretty. And you have twice the risk of getting admitted to the ICU if you have a COVID and are pregnant. So even if you're pregnant, get the vaccine.
Okay. Are there any known long-term health problems attributed to the vaccine?
No, okay. The average vaccine side effects are almost 95% of all vaccines occur in 2 weeks, okay? All of them have been reported within 6 weeks. So if you're going to have a problem, you're going to know it very, very soon. Now, there are no long-term studies. Obviously, this vaccine only came out, I think, last December for Alabama. So there are no long-term studies, but there are long-term studies on a lot of other vaccines. And like I said, if you're going to have trouble, you're going to know it right away.
Is it true that many have died from receiving the vaccine?
You know, there's one doctor out west. He says everybody dies within 2 years. Most people die within 2 weeks. Absolutely crazy. I don't know where these people are coming from. There have been 351 million shots of this messenger RNA vaccine. Okay. Anytime there's an event, there's a reporting system, whether it be I had hiccups, I fell out of bed, a car ran over me and daddy got killed. It's reported. Okay. There have been 6,600 reported deaths around the vaccine. Some of those got ran over by a car. Some have a heart attack. People die every day, but when each one of those are looked at very hard, and that's what the FDA studies before they give recommendations. And almost all of these are just circumstantial. Okay, they just happen to get hit by a car. They happen to have a heart attack. I mean, a lot of these are nursing home patients, and they're 80, 90 years old. They had a stroke, whatever. So out of 351 million, there's only been reported of all temporal related deaths, 6,600. Now, that is not 1%. That's not a 0.5%. That's 0.0019%. That is just infinitesimal. It's going to go down as one of the safest vaccines we've had. Much safer than the flu, much safer than mumps, much safer than polio. Everybody gets all worked up about this vaccine, but they have to have smallpox and polio to go to school.
Can you talk a little bit about how some have experienced blood clots after getting the vaccine?
Absolutely. That came primarily from the Johnson & Johnson. Now, let me say this. Johnson & Johnson, I've not been recommended that primarily from the beginning. It was only showed to be perhaps 60% effective, and whether your Pfizer and your Moderna are 95% effective. Now, 60% is almost twice as effective as flu shots. Now, if that had been the only vaccine that was produced, we would have been ecstatic. We were hoping for a 60% effective vaccine, but when we got these 95%, we were just blown away. So I've always recommended the messenger RNA. The blood clots. There are a small percentage they're mostly young women who develop blood clots, but again, it was just a smidgen more than happens normally. I treat blood clots all the time as a pulmonary doctor. Blood clots to the leg, blood clots, in the heart and lung. So there's a minimal increased risk, but it's minuscule. But I'm telling you right now, with the data I have right now, with Delta and the others, I'm going to recommend that if you haven't been vaccinated, get the Pfizer, Moderna, and those are available at your reservation medical center.
Will I get sick after getting the vaccine?
You might. Okay. Most people, 90% were like me. My arm ached that night. I didn't really sleep on it, slept on my right side. I may have a little, a headache, may have a little nausea. Most people have minimal symptoms like that. Maybe like if you had a flu shot or something like that. Some, like my third son, had to stay in bed. He was wiped out. He was fatigued for one day. Almost 100% are back to normal in the next day and or the third day. But it's that's your side effects.
Okay. What do you suggest for those who can't get the vaccine due to medical reasons?
Great question, and that scares me to death. Okay, first of all, right now in this Delta surge, stay at home the best you can. Get you a good mask. The Poarch Creek Indians are very fortunate to have the resources so that anybody that wants an N95 can get it. Call April Sells. She can get it from you, or the clinic can get it for you. They need to have that. They need to really, for the next 60 days, hunker down at home the best you can. I know that's tough, but if you truly cannot take it, and the only reason you cannot take it if you've had a reaction to another similar vaccine. But if you can't get it and you do get sick, do what I said. Immediately get tested if you have symptoms and call for the infusion. The monoclonal antibody infusion should save your life.
What if I've had an adverse reaction to vaccines in the past? Is it still safe for me to get the COVID vaccine?
That is the only contraindication to getting the vaccine. If you've had a significant reaction, I don't mean a sore arm, okay, but a significant reaction, talk to your provider, talk about what kind of reaction you really had, but that's the only contraindication we really have. And those are few and far between.
If you get the vaccine, can you still get COVID?
Yes. Okay. If you'd asked me this 8 weeks ago, I said highly unlikely. But we know now with the Delta variant that if you've been fully vaccinated, you probably have about a 20% chance of becoming infected. Okay. But the reason for that is the Delta virus is 1,000 times more contagious than the other versions of the virus. You can, but your symptoms are much, much less. It's usually like I have a cold, stopped up nose, little stuffiness, may ache a little bit, nothing bad. But again, 95% of the time we keep you out of the hospital with that. If you don't have diabetes, kidney problems, or had cancer or immunosuppressed, about 99% chance of keeping you out of the hospital.
If you can get COVID after being vaccinated, can't you still spread it?
Yes, okay. I've been vaccinated. If I came down with COVID today, that's why I isolate. I quarantine myself again for 10 days because I can spread it. I don't have the robust viral load that I had if I was not vaccinated, but I can spread it.
When do you believe the vaccine will be available for those under 12?
I think personally, I think very soon, weeks to maybe a couple of months. But the FDA keeps that pretty close to the vest. But the studies that have come out on the trials look amazingly safe and amazingly effective. Now, let me tell you about children. I'm not a pediatrician, but at Children's Hospital today, there is a 11-month-old on the ventilator, and there's a 11-year-old girl on the ventilator. We got 6 children on the ventilators and 33 in the hospital sick with COVID. So children, particularly under the earlier variants, were pretty much spared, okay? And they didn't get that sick. Things have changed with Delta. Much more contagious, and they're going to be a lot of kids that go to school and going to come back with COVID.
If you've had COVID and recovered, wouldn't you have antibodies to protect you?
You do. We know that if you've been infected, you do have antibodies. They, believe it or not, this is hard for people to contemplate, is they're not as robust as the vaccine. I have personally treated 13 people who have had the virus twice. I treated the very first one that reported in the world that had it twice, and he died. He got it first time in Italy before it was in America, and then he got it here in June before we had the vaccines. He went to a local restaurant, which shut down the next day when they had an outbreak of COVID, and he died of blood clots. Okay, he died of blood clots. Blood clots are much more common in the younger people, the 20s, 30s, 40s. So you can get it again. I'm personally treating the only person I know now that's had it 3 times, and he's been fully vaccinated also. So you do develop some immunity. We do not know how long it lasts. We do know that if you've been vaccinated and you have immunity, and if you get a booster shot, and probably all it takes is one of the messenger RNA shots, you have more, you have better immunity than anybody else, and you have the best protection that we can offer. So if people have had the get the COVID, I recommend when you start feeling good if you go ahead and get the vaccine. If you get the monoclonal infusion, I tell you to wait 30 days before you get the vaccine.
Will we need booster shots? And if so, why?
Yes. Okay. The CDC just last Friday approved a booster shot for the immunosuppressed. That's 3% of the population. And there's a list. If you got rheumatoid arthritis, on prednisone, solid tumor, lung cancer, prostate cancer, these kind of things, you qualify right now. I am pretty sure that within a couple of months that we'll recommend boosters for frontline workers, nurses, respiratory therapists, environmental people, people like me that work in the COVID ICUs all day, and people that are 60 years old and older. Okay, it's already been done in Israel. This is controversial because the World Health Organization has said, hold your boosters, because they want the vaccine to be sent to third world countries. That is a noble cause. I support that, but it's not David Thrasher's cause. My cause is to protect the people in Alabama the best I can. We know. I did a booster update about 2 weeks ago. We do know that your antibodies start to fall. I had the first vaccine in Montgomery in December the 16th. I checked my antibody level before my second shot, and it was off the chart. I checked it in June, off the chart. I checked it 2 weeks ago, and it had fallen by half. So we know that it doesn't stay maxed out forever. So we know it will slowly come down. But even if it comes down, you have another weapon that your body has, and that's called T-cell immunity, and that can last 100 years. So even if your antibodies that you measure are going down, you still have some protection. But we want you to have the maximum protection. So I predict that we'll start having boosters. Some people say every other year. I'm saying, maybe 8, 9, 10 months after your shot. But just stay tuned that we don't have all the specifics on that yet.
If you've already received the first dose, how long can you wait to get your second dose?
Well, if you had the Pfizer, it's ideally to get it in 3 weeks for the second one. If you had Moderna, 4 weeks. Some people say, man, my arm hurt like crazy. I don't want a second shot. But now they realize that they want one because they do not have the immunity that they need. If you haven't had one, go get one. It's preferably, we think right now, we're recommending if you have Moderna, get a Moderna booster. If you have a Pfizer, get a Pfizer booster, or the second shot, I should say. And if you can't get the other one, you can mix and match. We know it's safe. We know it works. But the party line right now is try to get the same one you did before.